DerryCAM is here recording, so it's very nice to be on your community television network this afternoon, or this morning. I keep thinking it's afternoon. But thank you all. I'm sorry to keep everyone waiting. You will all enjoy this. I was at a medal ceremony in Portsmouth for a 100-year-old World War II veteran who was part of the effort in Burma with the Flying Tigers. So it was quite, he started talking about his experiences, and I have to admit I couldn't leave. I had to listen to what he had to say. So,
nice. So
I do apologize for being late. And thanks, Sue, very much for being willing to serve as host this afternoon or this morning, and to everyone for coming and taking the time out of your busy schedules. I really appreciate your willingness to do that, and always nice to be in Derry. I will turn it over.
Thank you. Thank you so much again to everyone who came out today. We have a short period of time, as Chris mentioned, and I know that every one of you is touched by this issue and works really hard in different ways to make a difference in your communities and in your agencies. So we're going to try the best we can to have a great conversation, and certainly because it's the culture of what we do in Derry and in our region and in the state, we follow up with one another. We listen and we share and we solve problems together. So I'm sure that after today there'll be a lot of opportunities for us to do just that. So I don't want to take any more time. I think the Senator would probably want
I would
to
love
know
to
who's
have,
here.
yes. I know many of you, but there are some people here I don't know, so that would be great if you would tell me what you do and introduce yourselves.
Sure. Dave Karen, Derry Town Administrator,
Nice.
welcome.
Nice to be in your,
Nice to see you
your
again.
town.
Lori Warnock, Northern New England Poison Center, and Project New Hampshire First.
Good morning, Senator. Celeste Clark with the Raymond Coalition for Youth, and our drug-free community grantee.
Good morning, Senator. Dave Goldstein, Chief of Police in Franklin, and I have to say that 40 years ago I started working here for that job.
Wow.
Why did you leave?
Morning, Senator.
That's right. Why did he leave?
Same reason. I hope he's not after me. I'm Dr. Larry Kane from Dover. I'm on the board at Southeastern New Hampshire Services.
Oh, great.
Hi, Representative Phyllis Katz-Kors from Derry, and also an elected town councilor in Derry. And welcome to Derry, Jeannie.
Always nice to be here,
Nice to
Phyllis.
see you.
Hello, Senator. Carol Bowden. I'm the chairman of the board of the Derry Friendship Center. We're the oldest peer-to-peer recovery drop-in center in the state of New Hampshire. And yeah, thank you.
Hi, Senator. I'm Bob Sag. I sit on the board at the Derry Friendship Center.
Great.
Good morning, Nancy Sag. I'm a LCSW. I'm also on the board of Derry Friendship Center.
Good morning. I'm Stacy Lazar. I'm the Director of Public Health at Granite United Way.
Good morning. I'm Brenda Gugesberg, the Executive Director of the Upper Room Family Resource Center in Derry.
Good morning. Jeffrey Stewart, Concord Fire Department Project First Director.
Thank you.
Good morning, Senator. I'm Ari Roy, Sergeant of the Siena Police Department and a member of SoRock Coalition.
Kelly Bennett. I'm the current chair of SoRock, and I also work at Timberlane Middle School.
Good morning. I'm Jennifer Spather. I'm the Prevention Coordinator at the New Hampshire Coalition Against Domestic and Sexual Violence.
Great.
Good morning. My name is John Hall. I'm the EMS Coordinator at Parkland Medical Center.
Oh, good. Thank you.
Good morning, Senator. Vic Topo, CEO, Center for Life Management here in Derry. Nice to have you here.
Thank you.
Good morning, Senator. Chuck Hemian. I'm the EMS Director for the town of Derry Fire Department.
Good morning. Scott Haggard, Derry Fire. Good morning. My name is Mike Gang, and I'm the Fire Chief of Derry.
Nice to see you again. Chief.
Ed Garon, and I'm the police chief here, and I'd like to also announce publicly that probably my greatest accomplishment sits across the
You set him up for that.
Good morning, Senator. Good to see you again. Jay Fallon, Executive Director of New England HIDA, the high-intensity drug trafficking area.
Good morning, Senator. Chris Staywas. I'm from American Medical Response. I run the ambulance service for the City of Nashua and the City of Manchester.
Nice to see you again.
Morning, Senator. I'm Matt LaRochelle. I'm a lieutenant with the Manchester Police Department. I oversee our juvenile investigative unit as well as our domestic and sexual violence unit in Manchester.
Good morning. I'm Kim Haney, the Director of the Doorways at Granite Pathways in Manchester and Nashua.
Hi, Kathleen Murphy, Vice President of Substance Abuse Services at Farnham in Manchester.
Good morning. Elizabeth Duffy. I represent the South Central Public Health Network and Network Ribbon.
And Senator, we also have some folks who couldn't quite sit at the table here.
Good.
Lisa Fitzgerald, Grant YMCA Executive Director for the Londonderry branch.
Julie Donovan, Pinkerton Academy Prevention Counselor.
Hi, my name is Eve Hodgson. I work with Sue at the Community Alliance for Teen Safety, and I'm a Pinkerton student.
Great. And what year are you at Pinkerton?
I'm going to be a senior next year.
Good.
Hi, Senator Tim Lena. I'm the Director for Southern Rockingham Coalition for Healthy Youth. I'm also on the Governor's Commission as the Chair of the Prevention Task Force.
Sarah Holmes, I'm Senator Sheen's State Director.
Ian Keefe, I'm the Chief Nursing Officer at Parkland Medical Center.
Good morning, Patrick Cheatham with the Londonderry Police Department.
Good morning, Detective Mike Yesel, New Hampshire Police.
Good morning, Community Affairs Officer, West Salem Police Department, and Project First member.
Good morning, Beth O'Connell. I'm with the South Central Public Health Network and focusing on young adult strategies.
Good morning, I'm Laura Palmer, Assistant Superintendent of Schools in Salem and a member of Stand Up Salem Coalition.
Hi, I'm Christine Steele. I'm the chairperson of Stand Up Salem Coalition, Anti-Drug Coalition, that was not funded by the DFC grant.
Time to change that, right?
Ruth Kane, I'm his wife, and I'm supporting Southeast New Hampshire services.
Denise?
Oh, I'm just humbled to be in your presence. I'm Julie Huss from the Derry News. Welcome to Derry.
I'm Tess White. I'm from Timothy Sullivan.
Hi, good morning. Liz Jones from Community Health Services Program Manager.
Great.
Hi, I'm Denise Allison. First of all, I'd just love to tell you how much I admire you and
how much I
appreciate what you do for New Hampshire. And I'm a facilitator for a group called FAST, Families Advocating Substance Treatment, Education, and Recovery. And I've been doing the facilitating for 5 years now.
And where is your home base?
Derry, at the Marion Parish.
Hi, I'm Elise Burnett. I'm from Hampton, New Hampshire, and I'm a 7th grader at Hampton Middle School.
Minister Craig Barnaby. I actually work in the behavioral health unit now at Parkland Medical Center, recovery advocate.
Thank you. And we just had a gentleman come in. Would you introduce yourself?
Yeah, Mike Fowler, Public Works Director for the town of Derry.
Ah, great. Thanks for joining us. Well, as Sue said, Sue and Chris both said, I think, and you've met Chris Scott already, and that's John Jarvis, who works with me in my Senate office in Manchester. There are a lot of folks here, but I think that speaks to the challenge that we're facing. I mean, there are a lot of you at the table because there are a lot of people who are responding to the opioid epidemic that we've had here in New Hampshire. And thank you all very much for what you do every day to try and improve the lives of people in this state. I'm here because I wanted to talk to you about what you're seeing as we're in about year 6 of the increased challenge that we've been facing with substance misuse, but also because I wanted to tell you about a piece of legislation that I've just introduced that I hope responds to some of the concerns that we've heard from people in New Hampshire. We call it the Turn the Tide Act, and it's designed to address improved flexibility, recognizing that this epidemic has evolved and that we're not talking just about opioids anymore. We're also seeing meth come in. We're seeing cocaine in greater numbers. And as someone from the Doorway program told me, about 50% of people who are coming through the doorway are have alcohol misuse. So this is an evolving challenge, and we need to make sure that the resources that are available at the federal level change to address that evolving challenge. So it's focused on trying to provide more flexibility, on trying to address prevention, to really prioritize prevention, to recognize that what we don't want is a second generation that's dealing with substance use disorders, and so it tries to fund. If you remember the legislation that we passed in 2018 and the Comprehensive Addiction and Recovery Act that passed earlier than that, what it does is to fully fund all of those programs that deal with children with trying to address the next generation. It's a 10-year, $63 billion piece of legislation, and while that sounds like a lot of money, as all of you know, if we're going to get ahead of this and do what we need to do, we've got to be willing to invest the resources. And as we look at the current administration's assessment of what is the cost of this epidemic nationwide, it's estimated to be over $500 billion a year. So about $6 billion a year is a very small percentage of that to try and respond. So the bill also, as I said, it funds those programs that we've already got in place, and it tries to encourage initiatives like the ASSERT program in Manchester, and I know we've got folks here who can talk about that, but that's Adverse Childhood Experiences Response Team, and all of you who are working with kids know about ACEs and what we're learning about the need to respond. And one of the things that we try and do is to prioritize those programs that are dealing with ACEs and the need to respond to children. And the third piece deals with the challenges with workforce that we're facing everywhere in New Hampshire and across this country. So it increases the Medicaid rate, which is one of the big challenges that we have in New Hampshire. We're one of the lowest states in terms of Medicaid funding. It provides for loan forgiveness for people who go into the field to provide treatment. And it also does some things like eliminate the need for pre-authorization for medication-assisted treatment, which is one of the things that has historically slowed down the ability to get people into MAT treatment. It also eliminates the copay for Narcan. So if somebody's going in and trying to buy over-the-counter Narcan, it's about $130 on average. It would eliminate the copay that people have. Because as I know, all of you in law enforcement and first responders have been trying to do, we've been trying to make sure that people know that if we can get Narcan into the hands of people, that we can save lives. And so it's designed to help address that. It's got a number of other provisions, but I'm going to stop there. And I just want to end with one of my concerns, one of the achievements, let's put it that way, I think in the last 3 years in Washington has been a bipartisan effort to increase resources that are available to address substance misuse. And one of the concerns I have at this point is that attention is going to be focused elsewhere, and people are going to think, well, we made this investment, we're done now, we don't have to do it anymore. And what we know is that this is an ongoing challenge, and we're beginning to see slight progress. You know, if we look at the overdose death numbers in New Hampshire between 17 and 18, they went down, but they only went down a little bit. And what we don't want is for them to go back up. And we had a hearing before the Appropriations Subcommittee on Health and Human Services, and we had a number of people who provide treatment for people with substance use disorders. One of the people from New Hampshire who came down is a woman named Daisy Pierce, who runs Navigating Recovery in the Lakes region. And the question that I asked all of them, we had about 6 people testifying. I said, so what happens to your program if federal dollars dry up that you've been depending on? And Daisy said, well, I go back to bake sales. But one of the other people was a lot more blunt. He said, people will die. And that's what we have to remind people, that just as we're beginning to see some progress, as we see people who have come together in the way that you have here, which is very impressive, and that's what I see all over New Hampshire, is that law enforcement and treatment providers and educators and recovery supports, all of you have come together to address this challenge. And we need to remind people that we've got more work to do, and we can't stop now. And people are depending on the ability for us to continue to work together in Washington to provide the resources that you all need. So I'm going to stop there and see if I can open it up. I know Sue has got some people she may call on, but to hear from you about what you're seeing, what else we need to be thinking about in Washington as we look at trying to help you address this challenge.
Well, thank you, Senator. I know everyone here at the table has rich stories to share and important questions, and I'm not sure if there's one brave soul who would like to perhaps start. Kim?
Sure, I'd love to. Thank you. So the doorways, I just want to mention, are funded by the state opioid response, so the SOAR funding, and all of the doors open on January, so we've been open 7 months. And we're just, the programs are really just full steam ahead right now. The Commissioner Myers and DHHS, I just want to say, did a phenomenal job of rolling that out. They've been extremely supportive. There's been weekly meetings. But as we go, we are starting to see some of the gaps around the state. So I think this Turn the Tide Act will really help fill those gaps, and I can see that you have really listened to the doorways and the things that we've had to say about this. So I just wanted to put that out there and say thank you, and being able to use the flexible funding and some of these things for people with other substance use disorders will be a blessing. So thank you.
That's great, thank you. And one of the things we have benefited from, we were able to get a set aside for hardest hit states, and that increased our share of the state opioid response grant. So we went from a little over $3 million in 2017 to up to $34 million. I think we're up to $34 million this year. So that's been really helpful. And as you say, it's been very impressive to see the hub and spoke, the Doorways program roll out, and we need to continue to improve upon that.
Thank you.
So,
Senator, thank you for this. And for your work for your constituents and for our country. I'm Dr. Larry Kane. I'm with Southeastern New Hampshire Services that provides a myriad of services. But last year, we had to close the 30-day program. Show me the money is my comment.
Yeah.
We begged, and we had heard all the talk about the opioid crisis and how funding would come, but it didn't. We maintain the turning point, the 90-day program, and we have 28 beds, and we're able to operate that, and we're above water. We almost closed the facility. So money is an issue. This Medicaid supplement that came out is keeping us alive. We're progressing and providing the services. It's a great outfit, as everybody else is, and but money.
Yeah, I share that view. We need the support. Now, when you had to close the program, was it because a lack of community, state, federal dollars, all three? Was there a particular issue that you dealt with?
I would say mainly waiting for governmental money, whether it was federal or state, wherever the hang-up was. Until that got released in like January of this year, we could see that we weren't going to be able to stay alive. There are many reasons, but the Medicaid supplement is critical for providers, to get workers there, and to be able to take care of people.
For sure.
And Senator, again, like everybody else, thank you very much for this. In Franklin, we recognize this problem. Well, I've been there for 10 years, and if you recall, our former mayor, now Commissioner of Labor, started a program, the task force. While that has a law enforcement overtone to it, it really isn't. It's an eclectic group.
I remember visiting with it, the task force.
And we're the recipient of a $1.3 million grant from Drug-Free Communities, which is relatively rare for a community like Franklin, specifically and generally as well. In 2 5-year installments, we're coming to the end next year.
Right.
And our biggest problem, and this is exactly what we're focused on, is prevention. We went right into the schools, utilize the youth risk behavior survey, et cetera, to try to gauge where we are. And we took it out of the high school and actually now involved in middle school. And what we're seeing is perception of risk is a big issue. When our children feel that there isn't a risk because their parents tell them there isn't a risk in using certain drugs, then we're really fighting an uphill battle. So I would suggest that we continue on this. Treatment and recovery are very, very important, but we've lost a generation, and you mentioned that. We don't want to lose a second generation, and that's what we're aimed at. So I just wanted to mention that as well. We find that in the law enforcement, you also mentioned here in this summary, the fact that the mental health services for law enforcement, I would suggest that that's actually all first responders.
Actually, you know, we haven't corrected that. It is for all first responders. That's the way the bill is written, and I'm sorry we didn't get the summary changed appropriately. But yes, it should be all first responders, and it is. But
I would agree that it is taking its toll. And I would finally end with this. I've been around long enough so that I've been forced to become an historian in this field. And I was undercover in the late 80s. And I will tell you that in those days it was cocaine. But methamphetamine and heroin were still in the wings, and they've never gone away. So for us to think that by solving one problem we solve them all, I don't think is realistic. Thank you.
Absolutely, and that's the point of trying to be more flexible as we look at dollars that are available.
Senator, thank you very much for hosting this. I want to pick up where the chief left off relative to this partnership between public health and public safety. And I think you see that here, and it's so good to see professional educators here as well, because the education has to begin, as the chief said, the education begins at preschool and never ends. I'm speaking insofar as educating doctors relative to perhaps taking a less cavalier approach in a willy-nilly prescription of opioids. So it begins when your child can begin to understand, and it should never end. The one thing I would caution, you clearly understand this, and I hope you can send the message to your brother and sister Congress people. That is, let's not get too overexcited with a drop in overdose deaths, right? Because the overdose deaths, I think, and we've done some studies to confirm this, is a result of certainly rapid response on the part of first responders, police, firefighters, as well as having a ready availability of naloxone, both in the hands of the first responders as well as in the hands of the families of those afflicted with substance use disorder. I think we can start to claim victory, maybe see victory, when the number of overdoses go down. And it's going to be very easy to say, death's gone down, let's focus somewhere else. I would suggest to you that would be a major mistake.
Yeah, I certainly agree.
I would just jump onto that comment. Just from a medical provider perspective, we cannot let up the gas on those efforts, but also looking at the access to medication-assisted treatment, which families and patients desperately want. So it is an evidence-based strategy. There's great models around us to get moving on. So, you know, as you said, let's not fix one thing and watch other things deteriorate. This is a multi-pronged effort, and the gas on naloxone and treatment and access to treatment and help for families is critical.
Chief, I believe
Senator, welcome.
Thanks.
Others have said, and I would just like to echo that for anyone to think that we're winning is a sad mistake, and I'm so glad that you're not letting off the gas. Everything starts locally. Since we in Derry have been experiencing this problem and keeping records, we're well over 800 overdoses. We're well over 120 deaths. Wow. We are currently on track to have more overdoses but fewer deaths in Derry than what we've ever had, which makes the point that Jay has made, that it's the overdoses, it's not the deaths. The deaths are a symptom of the problem. And the number of overdoses that are reported to the police and fire, I would submit, has gone down precipitously based on the introduction of Narcan. So that these numbers are numbers, and to draw any specific conclusions from them other than they're increasing, I think is a mistake, because I think that overdose number is way higher than what we have a record of.
I heard that in Somersworth on Monday when I was there. They were talking about the fact that because of the accessibility of Narcan, that people aren't reporting overdoses in the same way that they did.
Yeah. More.
Yes, and then you.
I've been doing education all around the state on the subject of electronic cigarettes, and it is in itself a basket of mayhem for another topic. But one of the things that we know about nicotine and the effect that it has on adolescent brains is that it primes them for addictive behaviors later on in life. So any thought that we are wrapping up the problem that we're having with substance use disorder in this generation, we have the horses well out of the barn when it comes to nicotine addiction in the next group of youth. So it will be, for all of the things we don't know about the effects, health effects of vaping will have on the next generation, this is one piece that we do know. And so it will be the next wave of students at risk, of young adults at risk for substance use disorder.
Well, as you say, that's another topic, but it's something that I'm also very concerned about. And so I have legislation that would put in a fee structure on companies that provide vaping products as well as cigarettes, so that the FDA could regulate them in the same way, which we need to do now. Chief.
Good morning, Senator.
Good morning.
To throw a positive
Good
as to what's happening.
That's nice.
As my son recently had a surgical procedure and he had to be prescribed opioids for the first couple days after surgery. And the physician went out of their way to educate my wife and I on opioids and the dangers of them. They also provided us the chemical that you add to the opioid to neutralize it and be able to throw it away in the trash.
Oh.
Went to the pharmacy to get the prescription, and the pharmacist stopped us, educated us on opioids, gave us another
medication
additive. So anyway, long story short.
Yeah, that's great.
Parents are being educated now when they're giving these things to their children, and they're going out of their way to make sure that we have the chemical additive to destroy it when you don't need any more. So that's a good thing.
That is a good thing.
You know, hopefully we can continue on that trend. And in Derry here, we've been involved in a lot of collaborative efforts to try to curb the opioid issue. And I'm just going to turn it over to our EMS director, Chuck Hemian, who's been heavily involved with that to just kind of give an overview of what we're
Great.
doing. Well, good morning, ma'am, and thank you for coming to Derry. We have worked very closely in collaboration with our public health partners, to include at the front Sue Sentner and Katz. They've been phenomenal to work with. We've learned a lot from one another. We have seen a slight downtick in overdoses in town, and I attribute that to what the police chief had said, is that we have so much Narcan out in the community. We do a lot of Narcan training. We do just-in-time training. We teach CPR and hand out Narcan. The chief is just replacing 3 more boxes that we distributed yesterday, so they have an ample supply. So we're seeing a lot of our Narcan products out there in the community. So a lot of these are underreported. I still think we see more overdoses. We simply see fewer deaths. One of our visions, and this is no fiscal note attached to this at all, is that we would like to give access to, like the doorway and granted pathways, real-time patient care information. We have a program with the VNA for falls. When we have an elderly patient that falls, our software sends an email directly to the VNA, and they're able to pull up the patient care report and see the needs of that patient. They've already signed off on a HIPAA release, so that gives them permission to access that report. We would like to do the same with our overdoses. If I get permission from that patient that we just resuscitated, we get them to sign off on that, we can send real-time information directly to the pathways, and they can open up that report, and then they can get all the information on an individual, and maybe send out some additional resources. One of the problems we have at EMS is that we have so much Narcan in the community. It's not uncommon when we arrive that we've seen 8 or 12 milligrams of Narcan administered. They repeat it one right after another. So we have a patient that's totally unresponsive and apneic, and then 15 minutes later they're competent and have capacity. At that point they have the right to refuse. We try to sway them, we try to get them to go, we try to get them resources. More often than not, they do not want to go to the hospital, nor do we have any other places to take them. And that's a problem. So our thought is, well, if we could at least provide real-time information to, like, the pathway, and they can pull up a report, say that we were at X house and this is the person they dealt with. We have all the demographics and contact information. That will help streamline that process of connecting the dots. That's what we're all about.
And is that happening anywhere? I know that there are emergency rooms that are connecting people directly to treatment providers.
I could hop in, thanks. The New Hampshire Project First communities that have started in Hooksett, in Epping, Laconia, they're making direct referrals to the doorway now, which is amazing. And just to kind of piggyback, we have talked about that, and I think that would be a phenomenal a way for us to reach out the next day. As evidence shows, about 24 hours later, they're a little bit more open to having that discussion. We've also discussed having a satellite office. A lot of people don't want to come up to Manchester because it feels so far away. And that's kind of some of the things, if this funding does come out, that I want to make sure we revisit. Elizabeth has had that conversation, and having a satellite office with staff down here would be really great.
That would help a lot.
Yeah.
Because we're always faced with, they don't want to go to the emergency department, they don't want treatment. If we can get them to some resource, we may be a little bit more successful.
Project First is Project First Responders Initiating Recovery, Support, and Treatment. It's an FR CARA grant. We currently are running it in Concord, Laconia, Salem. Portsmouth is being chatted with today. Epping is doing a regional effect, and Hooksett. And it allows first responders to get that sign-off so that they can make the direct referral to the local doorway agency. And we're in our pilot stages. We're seeing some positive effect, but it is the information sharing that is the key link. And sometimes technology helps that, and sometimes there are barriers to overcome. But we're getting a lot of interest around the state in different parts of the community, and it's there are three components. One is educating providers on substance use disorder to help address compassion fatigue. The more they understand about substance use disorder, the more they understand that it's a relapsing, reoccurring disease process. Providing Narcan kits for them to distribute, and then making that connection with resources.
Good morning. I just want to thank you so much for the proposal for the third round of funding for drug-free communities grants. We are in year 9 of our second year of funding, and the capacity that we've built, we've worked with many of the people in the room connecting the dots to our small community of Raymond. When we talk about the per capita overdose rates and Narcan calls, we're on par in our small little community for cities like Manchester. So it's a real issue. But we have the capacity in our town to work with many providers and partners to address those things. And when we talk about the second generation of our young people, we have youth groups at the high school, the middle school, and we just expanded down to the elementary school because we really need to reach younger ages. One thing I feel like I have to comment on is marijuana use. Our young people are experimenting more. Parents are using. The perception of risk is so low around marijuana right now. And some people call it a gateway. That can be argued here or there, but that's a real concern for us, especially with the vaping, the two things. Our schools are inundated with it. But this third round of funding would allow us to continue our work, and it's a very big deal, so thank you very much.
Well, that's one of the things that I heard from you all. I heard it again down at Sanborn when I was down at the high school down there, talking to folks about what they're seeing, that, we set up these grants, as you pointed out in Franklin. You get things operating, you're beginning to see some movement and some progress, and then all of a sudden they end, and you may not have another source of funding. You may not. This is designed to have not only that third round, but also to try and focus on states that are hardest hit. I mean, this is another place where if we can try and keep the focus on the hardest hit states, it helps us more. So.
Can I speak to that? Christine Steele from Stand Up Salem. We have applied twice for the drug-free grant, and I look around the room and we're all volunteers doing it. And we're very fortunate to have the police and the schools, the faith community involved in our town, really concerned, and the business community that came together in 2015 to get this going. And if I look around the room, we have Franklin, we have Raymond, we have SOROC, coalitions that are already established that got the aid. We had someone from Granite United Way who had written the grant for us, who had never lost, and we didn't get the grant because so many people were applying for it. And it's so much work to apply for it when you were only working with volunteers and then not to get it. It's short money. It's $125,000 a year. But what the work that it's doing and is phenomenal, and through the school system with the YRBS studies that's telling us what's going on with kids and what they're seeing, and with the vaping coming up, with the marijuana, with the still alcohol, with the still the perception of harm. I think that's what we need to keep the prevention going, so we don't have to come back into this. We lost prevention for a couple of years, and this is what brought us to this state that we're in now.
Yeah, I couldn't agree more, and that's why trying to focus on states that are hardest hit, communities hardest hit, is really important, I think.
I think we have Julie, who is speaking from an educational.
So I work at Pinkerton, and I'm new at prevention. I have somebody sitting a seat down from me who has many, many years. But from my point of view in the school, this is the first year we had a prevention person. We've never done the YRBS. It's the first time in 200 or 300 years it's never been done, which is a little ridiculous, and I'm not trying to...
Why don't you explain for everybody what the YRBS is?
Risk Behavior Survey. It's given every 2 years. The CDC crunches the numbers, and it shows agencies what youth are doing, what are the trends and whatnot, and I'm sure Tim can explain it better. But I think that our legislation in our state should mandate the schools should not get a choice on whether or not you provide that. You need to do that. And working in the school just for 10 years, kind of a newcomer in all of this, schools are islands in and of themselves, and I don't know if people realize that. And they do a lot of what they want to do. And if they don't want to do it, they don't do it. Having a prevention role in my school is the first. I mean, it's wonderful. But if the state's going to do real prevention in schools, they also need to realize schools like to pull people in positions to do lunch duty and bus duty. It has to be prevention only. You can't be running a classroom and, watching a bus. You're there for prevention, and I almost, and as much as I don't like government, no offense, I almost think that government needs to oversee it for the schools to tell them, this is what's going to happen. You don't get a choice. This person is here to do these things, and that's how it's going to be. Because our kids, we're sending kids out to the ER because they're passed out in class from dab pens. Literally, we've Narcaned a kid. We've sent multiple kids out to the ER. We've had kids drop after Judge Broderick came to talk because they were eating gummy bears and they weren't feeling the effect quick enough, so the girl ate 2 more. They didn't know if she was on an opiate, so we have an increase of parents that are dead. We had a child come in this year, both parents are dead from opiate. Many of them are incarcerated, grandparents are raising them. So we're starting to just see that in the high school because of the age group. We're just starting to see this is the first tip, and it's coming. And I think we should be getting ahead of the methamphetamine before that comes too. And Klonopin, dab pens, cocaine. These kids, I mean, I grew up in the 80s in high school, and cocaine was the rave. It's back, and now we know it's being mixed with fentanyl. So I think prevention, and I'll stop talking, is so crucial.
Absolutely.
But the state needs to tell the school, Pinkerton, this is what you're going to do.
Phyllis, you can take that. Let me ask, though, as you're looking at your position, what measures of success are you listing? I mean, how are you determining how successful the work that you're doing is?
That's a good point, because I've only done it for 1 year, and I'm doing a lot of suicide prevention. In fact, I have a student here who is now a peer trainer. So our school is seeing success with suicide prevention, because we've been doing it for about 8 years now. We're having kids teach it. We were at Sununu's office in December. 800 students were provided lessons by their peers in suicide prevention.
That's great.
Youth mental health first aid should be mandated in every school, not we will do it if we have time. No, it's mandated. Every single person who works in a school should be aware of youth mental health first aid, suicide prevention. What are the drug trends? What do these kids look like when they're sitting in class and they need to be woken up? People need, and there needs to be accountability to the schools. The success I have seen is more, for me, more openness on part of the administration. And again, I'm going into year 2. So I hope I don't lose my job by saying this and nobody's watching community TV. But, so it's on TV, right?
Yes.
But anyway, so.
Yes. Can I add to that piece? Because I also work in a school, but I really believe that part of the drug-free coalitions can take on that because it's a community issue. A lot of schools are going to be worried about it's our issue and it's our kids, but it's not.
It's everywhere.
It is everywhere. I tend to see the continuum because I've got the prevention piece. I'm in the middle school, so I see that piece. I'm also a social worker at Hampstead Hospital, so I'm seeing the detox and the aftercare piece and just how it destroys at every level. So the conversation that I hear today is really about New Hampshire's a small state. We don't have any money, but we really need to communicate, and those are the things that we are good at. I know in our area, SOROC is great. I'm afraid to lose the relationships that we have so that when prom season comes around, you know, we gathered all of our police departments and we said, hey, do you know that the prom date for this community is here because we have kids who are doing this? And it was the first time we've ever had that conversation. You know, I don't want to lose those kinds of things. We need our coalition coordinators to make the prevention and the pastor resources, the parenting a second time around for all of our kids who are coming in impacted, and they are. And our schools don't know how to, you know, manage them really effectively. They do the best they can, but it's really a coordinated effort. So I'm grateful you're here to have these conversations, to keep them going. It really means a lot for our state.
Thank you.
Did you go ahead?
Welcome, Senator Shaheen. I wanted to speak from the WISE perspective. You know, outside of the education, we serve about 500 to 600 kids every day throughout the year. And thanks to Ori, we did start a PASTA program. What we're seeing is we're focusing a lot on the opioid crisis for those that are addicted, but we're seeing a lot of grandparents raising these grandkids that do not know where to go. So they're coming to us as a provider for child care and saying, okay, you know, I understand that my grandchild may have trauma or may have behavior problems or may have this or that, but I don't even know where to go. I didn't expect to be in this situation. Where are the resources? How do I do that? And so as a Y, we've done a great job collaborating with a number of folks in this room to really come together and say, okay, how can we use our joint efforts to focus on this community need? So that's been successful for us. But again, money is an issue, and those resources being available for those grandparents. It's a totally different demographic and dynamic of a grandparent trying to raise their grandkids.
Yeah, we have friends who are raising 3 grandchildren, and I can remember after they adopted him, he said, I hope I can live to be 80 because that's when the last one is going to graduate from high school.
So thanks for being present with us today and getting the input and so forth. Center for Life Management is the regional mental health center. We serve maybe 5,600 people a year. Very heartened to see you got workforce in there. Very important part. It's our biggest challenge right now. I can't quote the figure, but it's tens of thousands of people we'll need over the span of time, right, to help with this dilemma. So it's great to see that you've got that included in there. It's our biggest challenge right now at the center, just keeping people rates of pay. It's become so competitive for people and so forth. So that's really great to see that in there. One suggestion, though, the Medicaid payment rates, a lot of people, and everybody here knows this, a lot of people who need treatment don't have Medicaid.
Right.
Okay? They come uninsured, okay? But yet they still pose a public health challenge for us and so forth. So And as much as the payment rates will help, I think help us as an organization and as a system, somehow trying to inject dollars that are not specific to the Medicaid recipients themselves, I think if there's monies available, for that, I think that would be fantastic. But the payment rates will certainly help. And then something that's not in there from what I can see, but just a suggestion for you going forward is medication assisted treatment. You're familiar with it. A lot of people here are familiar with it. I think if there's a way to recognize more, these are very treatable conditions, and there's medications like naltrexone, Vivitrol as the trade name, but there's many medications on the market now, and there's so much advancement that's happening clinically, scientifically, with treating these conditions and so forth. But again, if individuals come forward and they have no method of payment, or even if they do and they're underinsured, these medications, they're going to be costly medications in a lot of instances, as you know. So if there's some way to kind of weave that in, I think that would be very beneficial as well, because they are very effective for many, many people.
Well, that's why the expansion of Medicaid has been so important, as everyone here knows, and allowing people to get treatment.
Great. Thank you. Thanks for being here.
So, just so you know, we've got probably about 5 minutes.
Okay. Let me just let him go first, since he has a chance to say something.
Again, I want to thank you so much for incorporating the drug-free communities additional rounds. I mean, you really listened to our plea, and thank you so much for being so responsive. I'd like to see so much of the emphasis on prevention. When we talk about Narcan preventing overdose deaths, that's really not prevention, that's harm reduction. And I think when we look at our educational system and our multi-tiered system of support for students and intervening, having universal programs that every kid gets, looking at those children, grandchildren from families where there's been overdoses and providing more tender, loving care to wrap around them. So the state task force has put together a strategic plan for the next 3 years, and as part of that, we actually had an ask of the federal government to look at a $25 million proposal. So looking at the needs and looking at the top priorities on the prevention end, as opposed to the harm reduction end, we continue as well. Because every dollar we spend, we're saving minimally $14 on treatment, recovery, and incarceration. So we're not going to treat our way out of this epidemic, and this, we're going to really need to really emphasize the dollars that way upstream.
Well, speaking of that, do you want to talk about the ASSERT program?
I would love to. I didn't want to jump in too soon there. So thank you again, as everyone else has said. You mentioned it in your opening remarks. The ASSERT program is a program we started about 4 years ago in Manchester with the help of many agencies, the YWCA, numerous agencies throughout the city that really our police department, we had officers going to these houses at 1 in the morning and seeing the victims that were children, the 2-year-old, the 4-year-old, the 8-year-old sitting in the corner, watched their parent OD or was involved in a domestic situation. And our officers were leaving the house thinking, that kid has no chance. So we came together as a community and formed this Adverse Childhood Experiences Response Team, which could gather these reports and send a team of a police officer and community members out into the community days later and follow up with these children and get these children services that they wouldn't otherwise have. So it's a great program. We appreciate that you've attached it to this. And hopefully we can get other communities involved. I look around, I see Rochester, Raymond, we did a presentation out there, Somersworth, Concord's about to start their program up. Laconia is in the end phases of starting their program, so it's just a great thing that we've started, and I'm a representative sitting here, but it was built on many organizations that came together, and collaboration is a key within your community when you do things like this. We're actually in the process of bringing in the fire department, the ambulance service, AMR, to capture those reports that we don't see as a police department, but that they see, that they can provide to us to respond out to the needs of those children. So again, thank you, Senator.
I just wanted to say that we in Derry are blessed to have the police and the fire department that we have. They're experts in what they do. As a legislature, we're starting to put in legislation. I was wondering if there's anybody in your office that I could talk to that maybe could help with a good piece of legislation that would pass to help solve this program. But I know there's people in your office that could help me, so.
That's a good segue, since Chris is telling me I need to. Chris Scott has been working on these issues in my office.
Yep.
Sarah Holmes introduced herself. She's my state director.
Right here.
And John, so, you know, call our office in Manchester.
Oh,
we have
okay.
offices in Manchester, Nashua, Berlin, Dover,
Claremont,
and Keene, and Claremont. Yes, thank you. So hopefully we're dispersed enough around the state so that if you need to reach somebody, you will be able to do that. And I really appreciate all of the time that you've spent, and clearly this is a conversation that's ongoing, and the participation of so many groups is what ultimately is going to help us address this. There is no, when I talk about this, I say there is no silver bullet. And what I have observed is that the most successful we are places where people talk to each other, where they're working together. As I said, law enforcement, treatment providers, first responders, educators, to try and address what we're seeing in our communities. And I think it's something that we've got to keep at. It took us a long time to get to where we are. It's going to take us a while to get out, but we need to continue the effort, and I really appreciate everyone here and the work that you're all doing. And any way that we can be helpful, you know, introducing this legislation is the easy part. Now the hard part is going to be developing a coalition in Washington to get it passed, but that's what we're going to work on.
How can we help you do that?
We will call on you, because we will need help as we're lining up sponsors. If you have, you know, we have support from the New Hampshire delegation, there's no doubt, both in the House and Senate. Senator Hassan obviously is very supportive, as are our members of Congress. But if there are people that you know in other states who you think, groups that you're affiliated with in other states who we can engage in this effort to help get co-sponsors and move the legislation, I think it's important. I think particularly reminding people that we're not done, you know, that we've got to continue this effort. That, I think, is probably priority number one. So, again, thank you all so much for being here.
Sure. Yeah, of course.
Have the doorway a little more involved with your program.
Okay. Yeah,
I don't know
for sure.
how,
Yeah.